Imagine you just woke up after emergency surgery in an American hospital. You feel okay. Then the nurse hands you the bill. $40,000. For an appendectomy. With complications, it can go past $50,000. You had insurance. Didn't matter. You still owe thousands. Some people lose their homes. Now picture the exact same surgery. Same procedure. But this time, in Japan. Your bill? About 45,000 yen. That's around $300. Less than a business dinner in New York. Same surgery. Same quality care. How is this possible? Today we find out, and we're going to expose the dark secret hiding behind Japan's miracle system. First, America. And the brutal reality of healthcare in the world's richest country. Part 1. The American reality. In 2024, the United States spent $15,474 per person on healthcare. That is the highest of any country on earth. By far. That's 18% of the entire US GDP. 1 in every $5 the country produces goes to healthcare. Need an appendectomy? That'll be $16,000, the national average. Add complications and you're looking at $50,000 or more. But Japan's total regulated cost for the same surgery is around 500,000 yen, about $3,400. And you only pay 30%. That's $300 to $400 out of pocket. Every single year, 530,000 American families are forced to declare bankruptcy because of medical bills. That's 1,000 families every single day. Right now, 20 million Americans, nearly 1 in every 12 adults, owe medical debt. 66.5% of all U.S. bankruptcies are caused by medical expenses. Medical debt is the #1 cause of bankruptcy in America. Here's the part that blows people's minds. 56% of insured Americans have medical debt too. Having insurance is not enough. In 2024 alone, Americans borrowed an estimated $74 billion just to pay for their healthcare. Why is it so expensive? First, American hospitals set their own prices. There is no law controlling them. Drug companies charge whatever the market will bear. An insulin pen costs $3 to make. In America, it's sold for $300. In Japan, $30. Insurance companies take their cut. Administrative costs, billing, coding, negotiations, eat up 25 cents of every healthcare dollar. The result? 2/3 of Americans say they avoid going to the doctor because of cost. They wait. They get sicker. And the bills get even bigger. So why doesn't America fix it? That's a whole other video. Today, let's cross the ocean and see Japan's secret. Part 2. Japan's system, the light. In 1961, Japan wrote healthcare into its national policy. Universal coverage. Mandatory. For every single person on Japanese soil. Every resident pays into the system. In return, you pay only 30% of your medical bills. The government covers the rest, 70%. There's also a monthly cap. Once your total out-of-pocket costs hit about $680 in a month, the government pays everything beyond that. Free. Here is Japan's most powerful weapon. The government sets the price of every procedure and every drug. Every 2 years. By law. No hospital can charge more. No drug company can override the price list. The government's word is final. If doctors start overprescribing to earn more, the government just lowers the fee for that service next round. The system self-corrects. The result is staggering. An MRI scan in the United States, $1,500. The exact same scan in Japan, $98. A doctor's visit in Japan, about $35 to $65 for you. With no referral needed. Walk into any clinic, see any doctor, anytime. Emergency room visit in Japan with insurance? Bring around $100. That is genuinely it. Japan's government aggressively promotes generic drugs to keep costs low. They also review the entire drug price list every 2 years. Japan also has one of the highest hospital bed counts per person in the developed world. Access is everywhere. The results are extraordinary. Japan has the longest living population on Earth. Average life expectancy, 84 years. Japan ranks among the top countries globally for health outcomes, despite spending roughly half what the US spends per person. Medical bankruptcy in Japan? Essentially zero. In America? 530,000 families every year. How does Japan fund all this? About 49% comes from insurance premiums, 39% from tax revenue, 12% from patient co-pays. You and your employer each pay about 5% of your salary. Healthcare is simply part of your paycheck, invisible, automatic, done. So, Japan, cheap, accessible, universal. Sounds perfect, right? This is where we need to stop and look closer. Because there is a dark side. Part 3: The Hidden Cost. Japan's population is aging faster than any country on Earth. Today, 29.1% of all Japanese people are 65 or older, the highest ratio in world history. By 2040, Japan's healthcare spending is projected to jump 60%. Experts warn of a potential 27 trillion yen shortfall. The math is terrifying. Here's the brutal math. Fewer young workers are paying into the system. More elderly people need expensive care. The ratio is collapsing. To keep the system running, Japan's doctors work hours that would be illegal in most countries. A 2022 survey, 20% of hospital doctors worked over 80 hours of overtime every single month. 80 hours of overtime per month. That is officially called the karoshi line, the threshold above which death from overwork becomes statistically likely. In fiscal year 2024, Japan recorded 1,304 officially recognized cases of karoshi, death and severe disorder from overwork. Healthcare workers, the number one industry affected. A senior Japanese medical expert said it plainly: Japan's healthcare system relies on the sacrifices of hospital doctors. The financial side is just as bleak. 40% of Japanese hospitals are now operating at a loss. 13.8% say they expect to close in the near future. 90% of clinics say they can't cover rising costs with what the government pays them. The very backbone of Japan's community healthcare is under threat. Japanese people visit the doctor an average of 13 times a year. Americans, just 4 times. More patients, same number of doctors, and burnout is accelerating. And at the national level, Japan's government debt, one of the highest in the world, is being strained further every year by ballooning healthcare costs. This is the brutal trade-off that no politician wants to talk about. Someone always pays. In Japan, it's often the doctors. It's the future. 2 systems. 2 very different crises. In America, cutting-edge hospitals, but bills that can destroy your life. In Japan, accessible, affordable healthcare, built on a foundation of overworked doctors, a shrinking workforce, and a debt clock that keeps ticking. There is no perfect healthcare system on Earth. Every country is trying, and failing in its own way, to solve the same impossible equation. How do you give everyone good care, without bankrupting individuals, without destroying doctors, without collapsing national finances? So here's my question for you. If you had to choose American healthcare or Japanese healthcare, which would you pick? And why? Drop your answer in the comments right now. There is no wrong answer, and I read every single one. If this opened your eyes, hit subscribe. We break down the hidden mechanics of society every week. See you in the next one.